Every single day, millions of adults over 60 take medications that help control blood pressure, allergies, acid reflux, anxiety, pain, or sleep. Most never imagine that one of those same medications could also affect how clearly they think. What if I told you that some commonly used medications have been linked in research to an increased risk of memory problems or dementia in certain older adults, especially when they're used for long periods or when several are taken together? The most surprising part? Many people never connect their forgetfulness to a medication. They blame stress, they blame getting older, they blame themselves. But in some cases, the medicine cabinet deserves a closer look. I'm Dr. Kalvin Stone, your AI-powered virtual health educator. In today's video, we're counting down 8 medications that may increase your dementia risk after age 60. Now, this doesn't mean these medications cause dementia in everyone who takes them. Many are important treatments that can be life-saving or greatly improve quality of life. The goal of this video is not to scare you or encourage you to stop taking your medicine. Instead, it's to help you recognize which medications deserve a conversation with your healthcare provider, especially if you've noticed changes in memory, concentration, or thinking. And make sure you stay until medication number 1. It isn't the medicine most seniors expect. In fact, millions of older adults take it every single day, often without realizing that many geriatric specialists recommend using extra caution with it in older adults. One simple conversation with your doctor could make a bigger difference than you ever imagined. Before we begin, let me know in the comments. How old are you, and how many prescription medications do you take each day? I read your comments and they help shape future videos for this community. Now, let's begin with medication number 8, one that's sitting in millions of American homes right now and is often considered completely harmless. Medication point 8, diphenhydramine, Benadryl R, and many PM sleep aids. Let's begin with a medication that many seniors don't even think of as a medication. It's often found in allergy medicine, nighttime cold medicine, and many over-the-counter sleep aids. Diphenhydramine, best known by the brand name Benadryl, has been around for decades. Because it's available without a prescription, many people assume it's completely harmless. But for older adults, the story can be very different. As we age, our brains naturally produce less acetylcholine, a chemical messenger that's essential for forming new memories, maintaining attention, and supporting clear thinking. Diphenhydramine belongs to a group of medicines called anticholinergics. In simple terms, these medications block acetylcholine. When that happens occasionally, the effects may be temporary, but frequent or long-term use may become more concerning, especially after age 60. Many older adults describe feeling unusually sleepy the next morning, mentally foggy, or having trouble remembering recent conversations after taking these medicines regularly. Researchers have found that a higher cumulative use of strong anticholinergic medications has been associated with an increased risk of dementia in older adults, although these studies show an association rather than proving that the medications directly cause dementia. That distinction is important. This doesn't mean that taking Benadryl once for an allergic reaction will damage your memory. However, using it every night as a sleep aid for months or years is something worth discussing with your healthcare provider. Another reason this medication often goes unnoticed is that it doesn't always say Benadryl on the package. Many nighttime products labeled PM, nighttime, or sleep aid contain the same active ingredient. If you're over 60, take a moment to read the ingredient label the next time you buy an over-the-counter sleep medicine. Sometimes the biggest risk is hiding in plain sight. And remember, never stop a medication without speaking to your doctor first. If you use diphenhydramine regularly, ask whether a safer alternative might be appropriate for you. Now, medication number 8 is available without a prescription, but the next one is prescribed to millions of older adults every year for a problem that's incredibly common after age 60. It helps relieve burning pain after meals and chronic acid reflux. What many people don't realize is that using it for years may have unintended effects that extend far beyond the stomach. Let's look at medication number 7. Medication 7, proton pump inhibitors, PPIs. Now let's talk about a medication that millions of seniors take every single morning. It's prescribed for heartburn, acid reflux, GERD, and stomach ulcers. Medicines such as omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix, have helped countless people control painful digestive symptoms. For many patients, these medications are very effective and medically necessary. But here's what often gets overlooked. Your stomach acid doesn't just digest food, it also helps your body absorb important nutrients. One of the most important is vitamin B12. Vitamin B12 plays a key role in keeping your nerves and brain functioning normally. Without enough of it, some people may develop memory problems, confusion, numbness, or difficulty concentrating. Long-term use of proton pump inhibitors has been linked in some studies to lower vitamin B12 levels, particularly when these medicines are taken for several years. Researchers have also explored whether long-term PPI use may be associated with a higher risk of dementia. The results have been mixed. Some studies reported an increased risk, while others found little or no association after accounting for other health conditions. In other words, the evidence is not conclusive. That doesn't mean these medications are unsafe. It means they should be used only when they're truly needed and at the lowest effective dose, exactly as your healthcare provider recommends. If you've been taking a proton pump inhibitor every day for several years, it may be worth asking your doctor questions such as, do I still need this medication? Should my vitamin B12 levels be checked? Is the current dose still appropriate for me? For some people, lifestyle changes, such as avoiding late-night meals, maintaining a healthy weight, limiting trigger foods, or raising the head of the bed, may help reduce reflux symptoms. However, treatment should always be individualized with a healthcare professional. The important message isn't to stop your medication. The important message is to make sure you're taking the right medicine at the right dose for the right amount of time. Sometimes that's all it takes to better protect both your digestive health and your overall well-being. Medication number 7 may affect the brain indirectly through nutrition, but the next medication works much more directly. In fact, it affects the same brain chemical that's essential for learning, memory, and clear thinking. It's prescribed to help control an overactive bladder, a condition that affects millions of older adults. Let's take a closer look at medication number 6. Medication 6, oxybutynin, overactive bladder medication. Let's move to a medication that many seniors rely on every day but rarely think could affect their memory. Oxybutynin, commonly prescribed for overactive bladder, helps reduce the sudden urge to urinate and frequent bathroom trips. For many older adults, it provides real relief and improves quality of life. But here's what deserves attention. Like the first medication we discussed, oxybutynin is a strong anticholinergic medication. That means it blocks acetylcholine, the same brain chemical responsible for learning, memory, and attention. As we grow older, our brains naturally become more sensitive to medications that interfere with this chemical. Over time, some seniors taking oxybutynin may notice they become more forgetful, have trouble concentrating, misplace everyday items more often, or struggle to follow conversations. These symptoms can easily be mistaken for normal aging. In fact, several observational studies have found that long-term use of strong anticholinergic bladder medications is associated with a higher risk of cognitive decline and dementia in older adults. While these studies cannot prove that the medication directly causes dementia, they have raised enough concern that many geriatric specialists recommend reviewing these medicines regularly. This is especially important if you're taking more than one anticholinergic medication because their effects can add together over time. The good news is that treatment options have improved. For some patients, newer medications such as mirabegron, Myrbetriq, work through a different pathway and generally have less effect on brain acetylcholine. However, the best choice depends on your overall health and should always be discussed with your healthcare provider. If you've noticed increasing forgetfulness since starting treatment for an overactive bladder, don't ignore it. Don't stop the medication on your own either. Instead, schedule a conversation with your doctor and ask whether another treatment option may be appropriate for you. Sometimes a simple medication review can make a meaningful difference. Now, medication number 6 is primarily prescribed for bladder problems, but the next medication is taken by millions of Americans every single day to protect something entirely different: their heart. It's one of the most commonly prescribed medications in the world, and while it provides important benefits for many people, some older adults have reported unexpected changes in memory and thinking after taking it. Let's take a closer look at medication number 5. Medication 5: statins, cholesterol-lowering medications. Now we've reached a medication that often surprises people. Statins, including atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, are among the most commonly prescribed medicines for adults over 60. They play an important role in lowering LDL cholesterol and reducing the risk of heart attacks and strokes. For many people, these medications save lives. So this section is not about telling anyone to stop taking a statin. Instead, it's about understanding a concern that some patients experience. Over the years, some people have reported symptoms such as brain fog, forgetfulness, difficulty finding words, or trouble concentrating after starting a statin. Researchers have investigated whether statins can contribute to cognitive problems. The results have been mixed. Some studies suggest that certain statins, particularly those that enter the brain more easily, may be associated with temporary memory changes in some individuals. However, many other high-quality studies have found no increased risk of dementia, and some research even suggests statins may lower dementia risk by reducing the risk of stroke and improving vascular health. That means the scientific evidence remains uncertain, and the effects may differ from person to person. If you notice new memory problems shortly after starting a statin or after your dose is increased, don't assume it's simply aging. Instead, write down when the symptoms began and discuss them with your healthcare provider. Sometimes adjusting the dose or switching to a different statin may help if your doctor believes the medication could be contributing. The key message is balance. Protecting your heart is also one of the best ways to protect your brain, because healthy blood flow is essential for normal brain function. Never stop a statin without medical guidance, especially if it has been prescribed after a heart attack, stroke, or because you have significant cardiovascular disease. The goal isn't to avoid treatment. The goal is to make sure you're receiving the treatment that's right for your individual health needs. The next medication has been helping people sleep and reduce anxiety for decades. Many seniors describe it as a medication they can't live without, but when it's used for months or years, it may affect much more than sleep. Let's continue with medication number 4. Medication 4: benzodiazepines, common anxiety and sleep medications. Now we come to a group of medications that many older adults have taken for years. These include medicines such as lorazepam, Ativan, alprazolam, Xanax, and diazepam, Valium. They're commonly prescribed for anxiety, panic attacks, and insomnia. For many people, they work quickly. Within a short time, anxiety settles down, muscles relax, and sleep becomes easier. That's why these medications can feel almost life-changing. But here's the concern: benzodiazepines slow activity throughout the brain. While this calming effect helps reduce anxiety, it can also affect attention, reaction time, and the brain's ability to form new memories. In older adults, these effects are often stronger because the body breaks down these medications more slowly than it does in younger people. As a result, the medication may stay in the body much longer, increasing the chance of daytime drowsiness, confusion, poor balance, and memory problems. Several observational studies have found that long-term benzodiazepine use is associated with an increased risk of cognitive decline and dementia. However, Researchers are still studying whether the medications themselves contribute to dementia or whether the underlying conditions, such as anxiety or sleep disorders, play a role. Either way, most experts agree on one important point. These medications are generally not recommended for long-term use in older adults unless there's a clear medical reason. Another concern is dependence. After taking benzodiazepines regularly for weeks or months, the brain can become accustomed to them. Stopping suddenly may lead to severe withdrawal symptoms, including anxiety, insomnia, shaking, and, in some cases, seizures. That's why these medications should never be stopped abruptly without medical supervision. If you've been taking one for a long time, your healthcare provider can create a gradual tapering plan if it's appropriate for your situation. For some people, other treatments, such as cognitive behavioral therapy for insomnia, CBT-I, relaxation techniques, or different medications, may provide safer long-term options. The goal isn't simply to sleep tonight. The goal is to protect both your sleep and your brain for years to come. We've now covered 4 medications that deserve careful review after age 60. But the next medication surprises many people because it isn't mainly prescribed for depression. Millions of seniors take it for nerve pain, migraines, or trouble sleeping. And according to geriatric prescribing guidelines, it carries one of the strongest anticholinergic effects of any medication commonly used in older adults. Let's continue with medication number 3. Medication 3, amitriptyline, often prescribed for pain, sleep, and migraines. Now we've reached the medication I asked you to watch carefully. Many people don't take it for depression at all. Instead, it's prescribed for nerve pain, chronic headaches, fibromyalgia, migraine prevention, or trouble sleeping. The medication is amitriptyline, sometimes sold under the brand name Elavil. For decades, it has helped many patients manage chronic pain and improve sleep. But in older adults, it comes with an important warning. Amitriptyline is considered one of the strongest anticholinergic medications still commonly prescribed. That means it significantly blocks acetylcholine, the brain chemical we've talked about throughout this video. Acetylcholine plays a critical role in learning, memory, and clear thinking. When that system is repeatedly disrupted, especially over months or years, some older adults may experience increasing forgetfulness, slower thinking, difficulty finding words, or trouble concentrating. These changes often happen gradually. Many people simply assume they're getting older, but healthcare providers are encouraged to consider whether a medication could be contributing. This concern isn't new. The American Geriatric Society Beers criteria, which helps guide safer prescribing for older adults, lists amitriptyline as a medication that should generally be avoided in seniors whenever safer alternatives are available because of its strong anticholinergic effects and increased risk of confusion, falls, and cognitive problems. That doesn't mean everyone taking amitriptyline will develop dementia. It means the potential risks often outweigh the benefits in many adults over 65, particularly when the medication is taken for a long time. If you're taking amitriptyline for nerve pain, sleep, or migraines, don't stop it on your own. Instead, ask your healthcare provider whether another treatment may be a better fit for your age and overall health. In many cases, there may be alternatives with less impact on memory and thinking. Sometimes one medication review can improve not only how you feel physically, but also how clearly you think. Now we've reached the final 2 medications. The next one is especially surprising because millions of Americans take it every day for depression and anxiety. Most people believe every medication in this group affects the brain the same way, but one stands apart. And many geriatric specialists recommend using extra caution when it's prescribed to older adults. Let's look at medication number 2. Medication 2, paroxetine, Paxil. We've reached medication number 2. This one surprises many people because it belongs to a group of medicines called SSRIs, which are commonly prescribed for depression and anxiety. In general, SSRIs are often considered safer for older adults than many older antidepressants. However, paroxetine, Paxil, is different. Unlike most other SSRIs, paroxetine also has strong anticholinergic properties, meaning it can interfere with acetylcholine, the same brain chemical we've discussed throughout this video. Because of this, the American Geriatric Society Beers criteria recommends avoiding paroxetine in many older adults whenever a safer alternative is available. Some seniors taking paroxetine have reported increasing forgetfulness, slower thinking, or difficulty concentrating. Research suggests paroxetine may have a greater impact on cognitive function than several other SSRIs, although individual responses vary. That doesn't mean everyone taking Paxil will develop dementia. It does mean it's worth asking an important question. Is this still the best antidepressant for me at my age? For many older adults, medications such as sertraline, Zoloft, or escitalopram, Lexapro, may be considered more suitable, depending on their medical history. Never switch antidepressants on your own. Always work with your healthcare provider, because stopping or changing these medications too quickly can cause withdrawal symptoms and worsen depression or anxiety. One conversation today may help protect both your emotional well-being and your cognitive health in the future. Medication 1. Multiple anticholinergic medications taken together. Now we've reached the medication risk I wanted every senior to remember. It's actually not a single medication. It's taking several anticholinergic medications at the same time. One medicine for allergies, another for sleep, one for bladder control, perhaps another for nerve pain. Each medication may seem harmless by itself, but together they create what's known as an anticholinergic burden. Think of it like carrying a backpack. One book may feel light. Add another, then another. Eventually, the weight becomes difficult to carry. Your brain experiences something similar. Each medication that blocks acetylcholine adds to the total burden. Over time, that combined effect may increase the likelihood of confusion, memory problems, falls, and cognitive decline in some older adults. That's why many geriatric specialists recommend reviewing all medications together, including prescription drugs, over-the-counter medicines, allergy tablets, nighttime sleep aids, and herbal supplements. Many seniors are surprised to learn that the greatest risk isn't one prescription, it's the combination of several medications that all affect the brain in similar ways. This is why a yearly medication review with your doctor or pharmacist can be one of the most valuable appointments you have. Sometimes no medications need to be changed. Sometimes a small adjustment can reduce side effects while still treating the original condition. The important thing is knowing what's on your medication list and why. If there's one message I hope you remember from today's video, it's this: never stop a medication because of something you watched on YouTube. Many of the medications we discussed provide important, even life-saving benefits for the right person. Instead, use this information to start an informed conversation with your healthcare provider. Ask whether every medication is still necessary. Ask whether the dose is still appropriate, and ask whether a safer alternative may be available. Those simple questions could help protect not only your physical health, but also your memory and independence for years to come. If you found this video helpful, please like, subscribe, and turn on notifications so you never miss our next senior health video. I'm Dr. Kalvin Stone. Thank you for watching, take care of yourself, and I'll see you in the next video.